We are live. Good afternoon. This is the House Appropriations Committee. It's Thursday, January 22nd, 2026. It's about 1:25. We're back talking about the budget adjustment. I know people this morning, we're going to go look at things. And we have, so I just kind of want to assess where we are and what we have left to do. So we don't forget anything. I want to review the public hearing requests again. We have a little more information from a couple of things. I can tell you what Nolan's been doing some work. We have some updates in the yellow section. So that was good. So we can discuss that. There may be other language. Grady's going to come in tomorrow for the language. Adam is going to come in tomorrow morning at 9 to talk about the updated budget adjustment pieces that they're doing based on the downgrade. So we have the language, we'll have an updated spreadsheet. Well, once we sort of figure out what we think we want to do, there may be some more language and where we're going to get the funds from. So that's kind of the part that's swirling around at the moment. So what I want to do is just briefly let you know what's happening in those yellow pages, sorry. So, the reach up piece was talking about adding statutory language related to the rate of reduction when they have excess money and using that in the future. This is a big policy issue, which upon discussion with members who are involved in this, I think we feel that that would be that the budget adjustment is in place for that discussion. And it should be in the part of FY27 budget or any other bills that come from human services, but they can take it up and address it as part of the human service piece. Okay. So we're just saying that's where the more appropriate place is. Okay. The Medicaid FQHC rates. I really like this one. They basically they came and they said, please do what's in the governor's rec. And we're doing what's in the governor's recs. Yeah. Check that out. I wish there were more of those. The tier 1 issue with the enhanced residential care providers who are out money. This ends up being a fairly large amount of money. I think Nolan will probably talk about it in more detail. But we end up making decisions. The decisions that we make, if we were to spend money here, automatically go into the base and for FY27, and we haven't really gone into FY27 at this point. So I think the feeling is that we're going to address this as part of the FY27 budget, and again, the policy committees. But we'll hear more from this. So you can. That ends up being a fair amount of money, and he'll explain that better than I just did. And then the last one is the AAAs. And we are going to get some numbers. This is the smallest one. When we set a 2% Medicaid rate increase for all the DAs and SSAs, Human Services gave 2% to a part of the AAAs, but not another part of the AAAs. So there's a problem related to that. So they didn't get the 2% related to case management. And this is looking like this. It's about $141,000. There's a question as to whether that's a gross number in general fund as part of that, or if that's a general fund number and it's a higher gross number. So no one's looking into that, and he'll come back and explain it.
And that's for all of the AAAs?
Yes.
Not just.
Yes, that's for all the AAAs. So of all the things on here, this is the one that might be doable. And I know Dave has some thoughts on this, and maybe when Nolan comes back, we'll talk about it. Is that okay? I just want to give kind of an overview of where we are right now. So that's the yellow pages. So back to the other, we talked about the State Housing Authority. Grady will have language on how that's going to work. So I think we're set on that. Wayne, did you talk to?
I tried to find him. He was here this morning, but
Yeah.
I stayed up there all.
Okay. Do you want to try to reach out to him?
I'll try to call him.
That would be great. Okay. Your name is on my list.
You got a
Wayne talking
I'll
to
find
John
it for him.
Sales. I got it in writing. Thank you.
I usually deliver.
I'm not writing it, I'm just making it up. We are getting some draft language related to HOP. Yes, so we'll talk about it. We haven't decided
actually
anything.
have that, and there's some, yeah.
So, and this is the one where we would be readjusting the shelter and then, so there's no new money involved. So draft language is coming. Katie's gonna come sometime this afternoon. There's about 4 things she has to share with us, and that would be one of them. So that's where we are with that. She can come at 2? Yes. Katie's coming at 2. So we have a few things that she's gonna talk about. I don't think we have any language, Dave, if you're wanting to address Tri-Valley transit, we would need language for that too. And I'm not saying we've agreed to it, but if we agreed to it, at some point, we're gonna need language for that. I think.
Trying to think what would the language say?
It might be very short, and maybe you can just talk to Grady about it.
Okay,
You know, if we decide to do it, it would be X amount of dollars for the purpose of.
if we mention that provider, we wouldn't
That would
mention
be
a
the
provider's
question.
name. Okay, I'll talk to Craig.
Yeah.
Yep.
Nolan is working on the recovery centers, and where the money might come from for that.
Where the money, and we have language that's.
And language that goes with it to be very specific as to where the money, this is likely to not be general funds.
Where would we find it? Probably the special, what's it called?
The substance misuse.
Yeah, special fund.
Special fund, which is where they've gotten their money before. That's where the money is. So if they've got a surplus, we can just use that. So, but anyway, that's what we're looking at. So that would be nice to not have to use general fund.
Yeah, right.
And Lynn, have you found out anything on Bridges to Health yet? I know we haven't had much time.
Now I'm gonna try to contact someone. It's another issue. I'm trying to figure out who to contact, all these new people, new commissioner, new
Yeah,
people.
I wonder if you talk to either somebody in the Ag Committee or in the Healthcare Committee would know who you should talk to about it, because they're the ones,
People, yeah.
those are the 2 committees that strongly support this.
Yeah.
So they should know. Okay, and then the end homelessness, we're gonna look at it in FY 27. Vermont Cares is still on the list, and would that be language too?
I have asked about that
Okay.
and do not know the answer to that question. Do we? There is language. I have forgotten. There is language.
Okay,
That,
Okay.
yes.
all right, so you'll
So
do that.
I'm working on that.
Okay,
Sorry.
and then Dave, you have an update on the Vermont Center for Independent Living?
Yes, it is Medicaid matchable.
Okay,
They are able to do that. Many of the home delivered meals programs throughout the state contract out with them to
okay,
serve the disabled people in their community
okay,
so that they can address not just the meal, but other needs
Yeah.
that they have.
okay,
So they're part of the portfolio and part of the quilt of providers that we have.
but they actually can go statewide, it sounds like.
And they do.
And they go statewide, all right, that's helpful to me to know that, because it's not just one. I worry about it when one place says, we just want it for Washington.
Or whatever.
Right, exactly, so it's statewide. All right. How do you feel about that one, the 30,000 for Meals on Wheels, if we can find the money, is that? I felt like people were interested in doing that this morning, yeah, okay, so let's have that right on our list as something you want to do. Okay. Is there anything else on here that we're ready to make a decision if we can find the money for it? Or do we want to wait and see where we've got?
So the only
From the
thing
money.
left on the orange one is perhaps the last one,
Yes,
140,000.
Right.
For the triple.
right. And there's a question, we can't do any retroactive payments. It's not allowed, when there's global commitment money. And then, so there's a question of, is it general fund? Is it how much? And if we try to use more general fund, then there's this whole thing about state-directed payments that we learned about last week, and we have to be careful about how all of that works. So Nolan's digging into it, and if I say any more, I'm going to confuse myself and everyone. I already am. So we'll get more from Nolan, who actually knows what he's talking about. Mike,
This, and maybe, and this is just refreshing my memory, for that piece, I remember having that conversation, about the retroactive payment and or rate increase. Did they clarify how this happened, why this was excluded from the rate increase?
I think this was another legislative intent that didn't get followed. No, I don't believe there was any clarification as to why this didn't happen.
Okay.
Yeah. Thank you for asking. I know, Dave, we didn't hear anything, did we, or you, about why this part wasn't included?
For the AAA's,
Yeah,
an oversight. It was an accident. People thought it was included, but didn't get passed on. And then nobody knew for sure whether it was in or out. But I got a call during the summer
okay,
and I said, I don't know. I remember I contacted Maria
yeah.
and she goes, it's normally in. This has happened before.
Uh,
Unfortunately, we've had a couple of years ago.
yeah,
And Jane Kitchell added it in to cover it.
yeah,
And that's why the agencies thought they were gonna get it.
right,
So.
right. I
it
mean,
was-
that feels like we should be taking care of that, assuming
Yeah.
it's,
The ball was dropped. No one knows by whom.
Can I ask a question?
Sure.
What does AAA refer to?
Area Agency on Aging.
Area agency.
They are the ones that tend to do Meals on Wheels. They also are the ones, as you're coming into Medicare, they have webinars and you can talk to people about how Medicare works and all those good things.
Yeah.
John, you know all about that?
I know now.
I know.
Happy birthday.
October 1.
There you go.
Last year.
That's right. Okay, yeah.
Trevor.
So I think that's where we are for right now. James or anybody else, or we have anything else that we're missing? I guess at some point, what we'll need to do is figure out where we're gonna get the money for the things we want to do, or where the money's available. It's some sort of matching thing, you know, it's a little bit of a challenge, but we'll work something out. You know, and some of these things we can get from other places, but then we,
Tomorrow morning, you all hear from Adam Correction.
Right.
About the administration's adjusted fiscal year 26 budget adjustment for
Right.
market downgrades. That will help inform that conversation.
yes,
And then we'll also have Grady walk through language about the changes as well.
Yeah. Yeah.
Requests.
so I think if, you know, we have a few areas where we have to decide things. We have the things on this sheet. We have, can we get money by doing something with a records check, $1 million? Do we take all of it? Do we take some of it? Do we take none of it? In any case, I'm sort of thinking we ought to have some language about that they need to address how they're gonna not have this problem. Because I think it's phrased. Right, I know, that's why I'm not the drafter. But I think we might want to have some language about how they're gonna address that going forward. So that's another thing we can think about. And I know I'm in touch with Emily, even though she's out sick today, she's functional, so. So she and I've had a couple of conversations about, you know, where are the possible pots of money and how much are we really talking about? But it's not much, that's what we know, it's really not a lot of money. But maybe we can do a couple
All
of
of the
things.
things we want. Or you're talking about?
In general.
District?
Well, no, we aren't gonna be able to do everything that's on this list, certainly,
No.
but we can see what are the things that that. And mine sounds like you so far agreed to one of them, so you can find the money for that. Okay, so you can have your own priorities, and if there's more checking you have to do in areas, some of you said you call or you whatever, so we can do that. So I think we'll go off live, and Katie will be here right at 2, and I'm sure she's on a tight schedule. So we'll be ready to go live at 2, and we'll hear the various language pieces that she's responsible